The presenting partner of this episode of The Kick is Baby Bunting. Save up to 25% off selected products store-wide in their Stocktake sale now.
Welcome to The Kick, your expert-led podcast helping you explore and learn everything about getting pregnant, pregnancy, birth and becoming a parent.
On the podcast and our online pregnancy program, Grow My Baby, we share my experience of helping more than 4,000 babies to be born.
And our experience of running a women's health clinic and parenting 4 boys.
We're here to help everyone to feel empowered in pregnancy and birth with real-life practical information.
Welcome everyone, I'm Brigid Maloney.
And I'm obstetrician Dr. Patrick Maloney.
And we've got Professor Megan Galbally back on the podcast. Popular demand. And we're going to be talking to her today about maternal attachment, which is also incredibly interesting and kind of groundbreaking at the minute, isn't it?
Fascinating area. Developing knowledge and a subject of current research.
Yeah. And I just want to give some bio for Professor Megan Galbally. She's an academic and has done a ton of research. You may have listened to her bio in the last episode, but just in case you haven't, she's the National Chair of Perinatal and Infant Psychiatry and holds honorary positions at the University of Melbourne, University of Western Australia, Murdoch University and University of Notre Dame. She's also Director and Professor of the Centre of Women's and Children's Mental Health at Monash Health and Monash University and is the lead in a longitudinal pregnancy study, Mercy Pregnancy and Emotional Wellbeing Study. Well, welcome back, Megan. Thank you so much for joining us again. I'm glad that you said yes.
We appreciate you coming back. It's great.
All right. Today we want to talk about maternal attachment. I think some people will know what maternal attachment is, but I think it's probably best, Pat, don't you think, if we start with defining what is maternal attachment and is it the same as being maternally, emotionally available?
Yeah, so there's lots of different definitions and there's lots of definitions out there in all of the parenting literature and in everywhere. But I guess if we talk about attachment theory, which is where the terminology came from, it came out of after Second World War from a researcher called Dr. John Bowlby. And it really is about that first sort of 18 months. In fact, attachment's important across our lifespan because it's about, the quality of our relationships and the way we relate to those that are important for us. But in terms of infant-parent attachment, it's that relationship that evolves over that first 18 months of life. And it's really, in essence, about providing that secure base. So the primary caregiver, often the mother, but not necessarily the mother, provides this environment, provides this secure base for the infant to explore. And if we just sort of dial it back a bit, we think about what that first 18 months is like in life. So you're born into this world, everything is new, every smell, every sound, every experience, learning how to walk and talk and feed yourself and all of these things. It's an incredible, the more I think about it, it's always just remarkable what humans do in that first 18 months, just Absolutely. Unprecedented in the lifespan in terms of that growth. But of course, with that comes anxiety. You think about now, if we just have to learn something new, I just had to log on to a new IT system today and, that can even generate a bit of kind of, what am I doing? How do I do this? So let alone for this little person learning and experiencing all these new things. So of course, there's going to be some stress and some anxiety for it. And so the primary caregiver and that relationship provides that secure base. And if you think about it, and think about a young baby and a mother, or a young baby and a father, or a young baby and a parent that you might have seen recently, and you as a stranger came in and interacted with that baby, you may have seen that baby look back to their parent, or even crawl back or toddle back to their parent and check in to see, is this person okay? Is this situation okay? And then when they're given that kind of reassurance of, yes, this is a friend or this is a friendly situation, then they might reach out to you, they might start to interact with you. You can see that kind of level of anxiety come right down. And that capacity to explore and have a new experience then comes to the forefront. So this is really important in terms of learning and feeling safe to learn and feeling secure to learn and have all of those new experiences. So it's really a fundamental part of that early parent-infant relationship.
I want to explore the idea because, you know, this is kind of a bit close to the bone for me, because I remember in my first pregnancy where a friend 6 months on said to me that her mother and herself and my friend had discussed myself and my relationship with my 6-month-old, and she said, look, I don't think you've got secure attachment. And that was kind of heartbreaking and true. Yeah. And at the start, I didn't feel that immediate love that people sort of talk about, that warm glow, and it didn't happen until later for me. But at that start, I was just petrified, I think. Petrified about raising this baby, petrified that I was getting it wrong, that, that he wasn't fitting the normal patterns, like he was underweight, he wasn't sleeping, blah, blah, blah. So, that feeling, I'm hoping you're going to say, is kind of common where there's not love at first sight.
Absolutely, and that doesn't mean, I think sometimes we muddle up lots of different things with attachment. So we muddle up bonding, so your perception of how you feel about a relationship. We muddle up how available you might be, how caring, how responsive, how sensitive in your response, so how you meet a baby's needs, what their communication, because of course often, they can't speak over that period of time, so they communicate in different ways. How do you read accurately what they're wanting and all of that stuff? And we sort of lump it in a layway all together into this term attachment, which is not what attachment really was set out to be in terms of both the theory but also then the research findings. And I think that can create some unnecessary anxiety. It isn't uncommon in all of our relationships, and so I really like to extrapolate that. If you think about any relationship in your life, sometimes it takes a while for that relationship to develop, for you to get to know that other person. It isn't always immediate in those feelings. But that sort of level of care that you describe, that kind of level of interest in well-being and care, that's part of this. And so that's a really important part not to undervalue. That's a critical part in terms of pregnancy and in the postpartum, is that interest. And indeed, many of our research scales are around reporting about interest in the sort of well-being of the fetus, or interest in the well-being of the infant or child. And it's quite interesting that when we do these observational measures of attachment, which are only really for research basis, there's nothing at the moment that's developed for clinical, that we often see what we term, in terms of the research base, secure attachment. But it doesn't all look the same in every parent and infant. So for some parents and infants, culturally, they're not necessarily effusive, maybe personality, or it might be culture. There's lots of different reasons at it. So they're not in there kind of making lots of noises with the baby, doing lots of sort of affectionate, effusive things, but there's still a secure attachment. So what we still see is that infant still feels confident to draw on that parent as a safety, as a secure base, and to explore and develop. And then there can be others who are indeed extremely affectionate, almost to the point of over-affectionate, where the baby kind of feels anxious about that. So we, I think there's just not one size fits all, but often we have these very narrow definitions of what a good parent is. They must feel this, they must do that, they must report this, which isn't really helpful, because we don't do it about any other relationship in life, do we? But we do it about this one.
That's true. That's true. So in the research setting about this, why is it of interest? What are we looking for?
So what we're looking for is that there's been, I think, quite a lot of theory and some research to back this up, that the quality of that relationship over the first year. And I would also emphasise that it's an evolving relationship. So again, if we go right back to the theory and the original research that happened with Bowlby and Ainsworth, it really is over that first 12 to 18 months. It was never expected that that would be all there at 6 months or at 3 months or at 9 months. It really does evolved. So we only measure it at 12 to 18 months for that reason, because it really is about, getting to know each other. It's about finding that rhythm. It's all those things that evolve over that first 12 months. So again, not that pressure that it all needs to be there day one, straight after birth. So, what we think, though, is this first 12 months, because of all of those changes that I talked about earlier, all of that growth, and particularly growth in terms of cognition and thinking and emotions and behaviour for that little person, that the relationship and its security may influence how that then goes on for that child into childhood, adolescence and adulthood. And as I say, there is some research to suggest that that is an important relationship that can have influence on how that child travels later on.
Parents, listen up, because right now there's a mega sale happening at Baby Bunting, and your wallet will thank you for these incredible savings. You can save 15 to 20% on selected Britax Plus series car seats, ensuring your little one travels in style. Or check out the massive savings of up to $300 off selected Maxi Cozy and InfoSecure car seats. That's right, up to $300 off. And the savings continue right across the store with up to 25% off selected car seats, feeding products, Manchester prams, cots, and more. Everything you need for your growing family at prices that won't break the bank. Baby Bunting's huge Stork Take sale is on now. Save up to 25% off selected products store-wide. T's and C's apply. Sale ends Sunday 29th of June, 11:59pm AEST.
Megan, it might help our listeners if we talk about what insecure attachment is.
Yeah, so there's insecure and disorganised attachment. They're the two other forms of attachment. So secure, insecure and disorganised. And then there are different types of insecure attachment. These were derived out of research. So this is a research measure and these are research classifications. And Bowlby and Ainsworth, who developed this research measure and these research classifications, very deliberately gave them letters of the alphabet, A, B, C, D, to define these, because they're not about pathology. So in the population, you have a spectrum of people who can be classified with a research measure as secure, insecure, disorganised. And again, it's a way that they respond in what I've described around that secure base. So can they draw on that attachment figure? Do they turn to them? Do they have that secure base? Or are they left to draw on their own resources more? Or do they not have a sort of strategy when they're feeling overwhelmed or they're in a new environment to draw on the primary figure at all? So they might try and draw on it and then they might pull back. So these are very much defined within the research realm, and I think we've got to be really cautious about then translating them out into the clinical realm or just into even pop culture, because they aren't really designed for that, and they are describing the whole population. And there are circumstances where, for instance, it can be, quite healthy for children to fit this insecure or disorganised. There isn't an absolute association, for instance, with insecure attachment and a later vulnerability to mental health or poorer development or anything like that. There's no, one doesn't add up to another. Again, it's about a whole range of factors that would lead to a vulnerability, of which this might be one, but also might not be. So really important that we don't also overemphasise it. Of course, the relationship is more than attachment too between a parent and a child. And again, we need to remember that this is one aspect that we measure of a relationship, but it's really important, all of the aspects, just the enjoyment between a parent and a child, how they get on, how they resolve conflict. That's really important, isn't it, when we head into toddler and adolescence. The wider family, again, Bowlby's theory came out of the 1950s, when it was the biological primary caregiver, stay-at-home mum and the infant. And so that was the focus. That was thought to be the be-all and end-all of this dyad. We now have very different families where, and the research is now showing the importance of the father-infant relationship, the importance of grandparents, the importance of community. I think a lot of our ideas around this are really evolving over time as well.
I've heard it from friends and myself thinking about a clingy or a child that cries all the time. Are they signs of an insecure attachment?
No, not necessarily at all. Again, babies have really different personalities, don't they? They have different temperaments. They come into the world, and anyone who's had more than one child will certainly know that really similar parenting or similar family circumstances, and you can have really different people. And sometimes that's that the parent's a bit different. We often talk about, once you've had more than one, perhaps you become more relaxed in your parenting, but often it is something that the baby brings again. And I think more and more as we see babies as individuals, as little people who bring their own way of being into the world, the more we can understand the sort of the nuance of that. So we certainly know that some babies, need more routine, for instance, have more difficulties, with stimulation. And so therefore they're often, lighter sleepers. They wake very easily, and so they need much more clear kinds of, structures around their sleep. And others will just go to sleep anywhere. And the parents will often say, it's nothing, I did the same parenting with both. I don't know why this difference. So again, we've got to think about this, I think, in a little bit more of a nuanced way, I think, rather than it's all about one particular thing.
Megan, tell us about what research you're aware of looking into the development of quality relationships between babies and dads, because there's a pretty common feeling amongst dads that there's nothing much in particular they can do in those early years, and that they'll develop a quality relationship with their child later on when they can talk to them or do stuff with them. But what about, is there any research that talks about development of a quality relationship in the early phase?
Yeah, absolutely. And again, the research more recently has certainly been able to articulate that both the dad and the infant have an attachment style, and the mum and the infant have an attachment style, and it might be quite different. And it may be very complementary. So it's a really important relationship in that I think for so long we've focused on, all of this time period being really about the mum and the infant. And so that's put an enormous amount of pressure. If the infant's clingy, then it must be something to do with what the mother's doing. Is it to do with the quality of the relationship? Is it because, she might be anxious or down? All of this sort of pressure on there, which what we realise is now it really, it's about the package really that the infant's experiencing. It's about the relationship with the dad, the relationship with the mum. If grandparents are involved, they can be really important as well. And I think that really early relationship can be a really important foundation for later on. How you sort of, in a way, negotiate things like sleep and routines and feeding and all of that really can start to get for that dad to understand that infant as a person. Because like I say, every baby's different, aren't they? Every baby comes into this world and is a bit different from another. So again, how is this a particular child that is going to need a lot of structure around bedtime? So for the dad to kind of get a sense of that early on, and then to build that into those later interactions. Because every child is not going to, again, be the same in how they want and what's going to be really good for them in terms of their relationship with their dad. Some will want a really active relationship with their dad, and that'll bring a lot of benefit to them getting out there and doing lots of sports. But other children, that's not their thing, is it? And so having a different style of relationship with their dad might be really positive. So again, the dad getting to know that little person and how they are and their needs in the world, I think is really good.
And, just being a mother of 4, I think a lot of it comes down to people thinking that it's about the amount of time that they spend with their child, but it's perhaps not the amount of time, it's the quality time. making the minutes count. If you're there and you're present, then those minutes are counting. It's not just about being there. Megan, I want to talk about adults and adults that have, through their own counselling sessions or psychology sessions or whatever it is, it's been uncovered that they perhaps haven't had secure attachment in their life, and their mental health or even their physical health has got a lot to do with that attachment. What are those? Are they more prone, or are they? How do they go in terms of building that attachment with their own babies when they have their children?
Yeah, and again, this has been a really interesting and eye-opening part of our research and other research groups around the world, is that there was a thought that whatever attachment you had with your parents, or the style of relationship that you had with your parent growing up, that was very likely to influence how you parented. Almost kind of an inevitability to it again. But in fact, with more and more studies, so there was a meta-analysis that showed some relationship between a parent's attachment style to their own parents and their child, and then another meta-analysis. So a meta-analysis is where you put lots and lots of studies together and you look at the pooled outcome. The second meta-analysis more recently showed an even weaker relationship between the parent's attachment to their own parents and their attachment to their baby. And more recent research, including our own, has shown very little relationship between your own attachment style. And this is using really gold standard research measures. So we use something called the adult attachment interview, which is an interview-based measure with the parent. And then we use something called the strange situations procedure, which is the gold standard measure of infant-parent attachment. And again, we found very little relationship, including those who had clinical depression. So depression that was being treated and was of a clinical nature, not just depressive symptoms or stress symptoms or that sort of thing. So again, that's really heartening that whatever we're bringing into parenting, there are other things that clearly go on that mean that we can parent in a different way to the way we were parented. So I think it again is a really hopeful message that's coming out of the research.
Good. So when they say the apple doesn't fall far from the tree, that's been no, that's been debunked.
I think that's an extremely hopeful message.
Yeah.
Because people really don't want to repeat what they see as mistakes from the past.
And some people are making a decision not to be a parent because they don't want to be a parent like their parent was.
Yes.
Yeah. So, that's good. We all have the chance.
Absolutely. And again, I go back to thinking about if there is depression, anxiety, seeking help, seeking treatment, if there's trauma that's unresolved, again, reaching out for help are all really critical parts of that.
I just want to further explore for children that are in a insecure or a disorganised attachment style, what are their signs and symptoms in development?
Yeah, so sometimes, look, I don't want to overcall it because it is based on research measures, but it is that sort of thing where they're, really difficult to settle. So a normal child, when they come into a stressful situation, so if I was to walk in on your infant and you were to introduce me to your infant or you to mine, they might get, they might be a wary infant or an infant that is prone to sort of getting stressed, so they might show signs of clinginess or stress to begin with. But usually what happens is that as the parent is very calm and positive about the environment, that you'll see that come right down. And so that's a sign of security. So it's really important that we don't think that any clinginess or any anxiety is a sign of insecure or disorganised attachment, because that's just not the case. Like we talked about, people are really different in their appetite for risk, in their appetite for novel things and new things. Some of us are more wary, some of us are more outgoing, and that's the same in infants. So a bit of clinginess in a new situation, not necessarily a sign of anything. But if it persists despite reassurance, that's when in research we might start to think about that in terms of insecure attachment or disorganised attachment. But I really want to emphasise that even if we're concerned in a research setting that this is insecure or disorganised attachment, that doesn't necessarily mean anything in terms of emotional development for that child, other aspects of development around it. And really the only way of knowing whether whether there's an insecure or disorganised attachment is through these research measures. Looking at an infant, in a moment and not knowing those circumstances. Lots of people make lots of sort of value judgments, and it isn't necessarily supported, I don't think, by the research, or if we did it more rigorously in terms of looking at what's going on with that child.
Value judgments. I hope that I hope that we're moving away from them, but I know that we're not. So
I hope we're getting better at it.
Well, yeah, I hope so.
Megan, what degree do you think sort of quality parenting of young children is something we can teach or learn? Or are we all just winging it?
Yeah, look, I think I do really believe in the support, and that the support be tailored to what that parent needs. So I think for many of us, we come to parenting for the first time with really very little either observation or direct experience of looking after a young baby. Certainly for myself, bar my paediatrics in my medical training, I'd had very little to do with babies. So that real practical support, how do you wrap a baby, feed them, settle them, all those really practical things were really critical. But then for other people, that is not an issue, and particularly once you've had more than one baby. But maybe there has been a bit of a rocky pregnancy. Maybe the delivery was really, exhausting. And so there's that delay in feeling that kind of, warm relationship with the baby, because really for the woman, she's recovering mentally and physically from what's been a really tricky time. And so again, then that might be more emotional support to really, and physical as well, practical physical support, so that that recovery can occur and that relationship can then have room to sort of grow with the infant. So I think there is a bit of teaching, the practical skills. I think I'm really surprised sometimes when we focus a lot on, say, attachment or the quality of the relationship, and we forget that this poor first-time parent hasn't even been shown how to do those basic things, and so no wonder they're so anxious and worried about it all. And then other times it is about what else is going on for these parents. Is there enough support? Are there stresses on them? Have there been other things that have happened, like, as I say, a really difficult delivery or a really difficult time in that early postpartum? Some babies really unsettled in that first 12 weeks, and again that can be a really hard time emotionally, developing a relationship and all of that. So what can we do? How can we bring in support? How can we give them a bit of a break so that there is room for that relationship to develop? And then for some people, there are really, I guess, things that have come from their own experience of being parented that are influencing how they're feeling about being a parent. And so again, there might be some counselling or therapy or psychological interventions that might be really important for them, so that they can have a fresh relationship, a fresh start as a parent, and feel that kind of capacity, rather than hanging on to these things that are there from past relationships and experiences.
Megan, I just want to finish with this question. Someone who's listened to this episode, and they've picked it up because I'm guessing most people would pick this up because people just want to have this attachment with their baby, which is fabulous. But if this episode has made them question any of that, where is their first port of call?
Yeah, I always think your GP is a really important resource, because it is about thinking about, is there some stress, anxiety, depression, or anything like that going on? Because certainly for women who have untreated depression, for instance, and anxiety, that can mean that everything feels difficult, everything feels bleak. And so that can mean that even if the relationship with their infant is quite strong to outsiders, it can feel very bleak. And so again, the importance of getting that treatment and getting that support. It may be, though, that it's more around counselling and some psychotherapy, because there are some things from the past that are coming up for the first time that are unresolved, and they're coming between being able to really form that new relationship with this new little person. It may be that it's about the couple. It's a really big transition for couples, having their first, second, third, fourth child. So again, how is this family expanding, adapting? How's the couple relationship going? So that might be the focus. Or it could be that this little person is bringing some challenges, and some babies, are very unsettled or are very clingy, and the parent may not feel like they've got the confidence to kind of parent that baby. And so some parent-infant work might be really appropriate. So again, the GP can help to steer this in the right direction to really look at what is underlying these concerns. Because I agree, everyone wants to have a good relationship. We don't go into this, do we, wanting it to be hard or tricky. So it's finding that support for what the concern is, I think that's really important, and getting it as early as possible.
And not being embarrassed or guilty by putting up your hand and saying, look, this is tricky. I don't think I'm doing it how I want to do it. It's not based on how your friend down the road's doing her parenting. It's basically how you feel in that moment, and feel whether you're doing the best by yourself and by your baby and your partner if you've got one. All right. Well, thank you so much, Megan. I think that'll be very interesting listening for everybody. Thank you for your time. I know you're extremely busy, so we're going to let you get back to work.
We really appreciate you coming on, and we appreciate your academic focus on all of this for the improvement of our understanding of this really important issue.
Thank you very much, and thank you for the invitation to be on this. Really appreciate that.
Fabulous. Brilliant. What a fascinating discussion.
Yeah, I'm really interested in this. It's obviously a field of emerging and evolving research, but how fascinating that they're looking into the establishment of quality relationships so early on.
Yeah, and also that, the original people that thought about maternal attachment was from the 1950s, and it's taken maybe this long for somebody to pick it up again and say, hang on a minute.
But we're living in a very different world.
Yeah.
Very interesting.
Good. Well, thank you everyone for listening this week. We hope that was really informative. We'll be in your ears next week. We're very excited about what we're bringing to you next week. And until then, have a great week, everyone.
Thanks for listening.
Bye for now. Hey, even though Dr. Pat is, a doctor, and we get lots of other doctors and other experts on our podcast, I just need to remind you that this podcast is for informational purposes only. We share lots of medical insights and experience, but everything we talk about is general in nature and may not apply to your specific situation. Please always consult with your own healthcare provider for your individual medical advice when you grow your baby.
The presenting partner of this episode of The Kick was Baby Bunting. Save up to 25% off selected products store-wide in their Stalk Take sale now.